Assalamu alaikum. Furamendhuru muling a program kan huri habelantena marhaba. Meduga program garumne waha dakka gani global hospitals ke faratum rajya ga kuramunda maseketta ka gulegotu meduga program ga armenna mi mawduga malumat devani lanka ge Forte International Private Limited ge CEO and chairman Muhammad Farid Ahmad Riyas thing arme meduga program kuriya gendani ingeresi bahun bedanterina me malumat geneste mundani. Riyaz, welcome to the program. Could you first of all give us an introduction of Global Hospitals itself?
Assalamu alaikum wa rahmatullahi wa barakatuh. Now I'm from basically Sri Lanka. We are looking after global hospital interest in Sri Lanka. So we are also, part of Maldives is also coming under my preview. So I'm looking after Maldives market as well. So global hospital, my connection with Maldives is more than 15 years. I do many things with Maldives, like being a pharma person, pharmaceuticals, and many things. So in this program, we have started last 5 years ago in Sri Lanka as an information and facilitating center for global hospitals. That means we refer patients to global hospital, like whatever cannot be done in Sri Lanka, or that are high-end surgeries cannot be offered in Sri Lanka, will be taking patient along. So it's not only a patient going to India, we also bring value added back to Sri Lanka and Maldives as well. Likewise, we are time to time we have continuous medical education, that is CME programs with among the doctors, just to keep them understand what latest things happening in India and what are the things happening in global hospital. And then this is a continuous relationship between the doctors. So it is worldwide, it happens, but then we as global hospital, Sri Lanka, Maldives are the group that we manage this. So last 2 years ago, our presence, so whatever we do in Sri Lanka, I used to bring that to Maldives also, because that is our neighboring country and we are all SAARC countries. We are all together always, so therefore we bring this program here. So I came up here and then we set up with a private clinic. We registered our super specialty doctors in Maldives, and then privately we saw patients in Maldives. So that went on to about 1 year. Then with our capabilities, we have proven to the Maldives patients, what is the outcome whoever goes to be a global hospital. And with that, we were able to register with Asanda a special package that we have given to Asanda and said, we are also with you all to serve your patient.
You mentioned we are talking about the latest technologies in the medical field. In India, you mentioned, is the global hospitals only based in India, or is it in other countries too?
As it is, they are only in India. The recent development is also they are in 4 major cities with 9 hospitals, 2,500 bedded. Is the 3rd largest hospital group in India. And then very recently, this January, there was a merge with Parkway, the 2nd largest hospital chain in the world, has also taken some shares of global hospital. Not only for only reason to be the market leader in Asia. So with this program, there is actually what we are trying to do is now, when you say Parkway, they are from Singapore, is one of the high standard hospitals are over there. And Indian doctor skill, which nobody could match today, that and the local price. To have a nice combination like this, they have merged together. So this will definitely bring the healthcare wherever they are involved to a different level in any country. So this will be the same in Sri Lanka as well as to Maldives.
So you also mentioned that you have special, since you started working with Asanda here in Maldives, you have special packages for Maldivians, or
Yes.
special. Could you give us some detail on that?
So basically, when it comes to question of insurance, we need to work with a particular institute in a very closely coordinated way. For example, we have given them a package where, say for particular surgery, say liver transplant, it costs so much, right? For a neuro or a brain tumor, it will cost so much. So likewise, a renal transplant, a kidney transplant patient will cost so much. Likewise, we have predicted this thing, and we are given, and we have an agreement signed with the Asanda. So this, why this is being given is to make sure that this entire thing is, this program is, the money is spent by the government of Maldives. So it's an understanding within the government and the hospital.
So it's mostly the government is paying for the patient, or does the patient also pay?
Yes, the Asanda program. Through Asanda program we are getting, or also there are some other patients who go directly and have their own facilities also.
So your global hospital specialists have been consulting in Maldives, I think.
Yeah, one of the few people, as I told you, our presence are here last 2 years ago, and we registered the patient, the doctors, and then we saw the patients. Now, as it is last 1 year, we are with Asanda, and then Asanda gives us the program, like, every month they schedule 4 doctors or 5 doctors in different categories of doctors, specialities, and then also they also set up where they should go and consult patients, and they have a program prior to doctors arrive in that particular. It can be an Addu, it can be a separate area where they do the awareness program, saying that this particular doctor is coming on this particular day and this is his specialty. So they collect all the patients around that particular hospital, and the moment our doctors come there, they go and consult them. So every time a doctor comes, they stay here 1.5 days, 2 days, and even at a time we have seen 200 patients. A doctor has seen 200 patients at a visit.
So first thing, 200 patients is a lot to see in 2 days.
Yes.
Or 1.5 days, you said. How?
There again, it's depending on the requirement and the patients.
Yeah.
Right.
Then again, we see a lot of patients in Maldives. How much is the population of patients that go to you?
No, right now, if you ask me on a percentage wise, we are right now Asanda is in panel with Sri Lankan hospitals as well as the Indian hospitals. Around 9 hospitals including us. Out of these 9 hospitals, we must say that we are getting a major share from this program. We are one of the pioneers to initiate this program as well. And then moreover, it is the outcome of the patient. High-end surgeries which we have done, namely I have very few of the main segments that we have done, and then how successful those surgeries and treatment. it is where a lot of people have started going to global.
So we have big success stories from Maldives.
Of course, we have many success stories.
Can we go into one if it's
Detail in
possible?
one or two. If you see, we are the only one of the Asia's the biggest center of liver transplant. That is, Global Hospital Group does the liver transplant. That is we have about 4 success liver transplant patients over here.
From Maldives.
And then also, if you see, kidney transplant program is we are the first to initiate on this, and we have screened most of the patient in Maldives, and now we have almost completed more than 20 to 25 transplant is completed from Maldives.
Over these 2 years.
Over these 2 years, it is a very big number if you take it from an institute to do it, because all these people were dialysis, and then over a period of time they are in this sickness. Moment we diagnosed it and they had the suitable donor, so then with the donor they went and completed. So still more, there are few more patients are waiting to get the transplant done. So likewise, I can keep on saying neurosurgeries, scoliosis, neuro spine surgeries, amazing work that we have done here. There are many evidence around here.
I remember we had one of those surgeries with a woman last year, I think.
Yes.
You had one surgery, a very
Exactly.
interesting one.
Very interesting. It was like it's a bone defect, or later she had developed spine was like an S. So it was corrected, and then she was unable to walk or sit or anything. So today she is with us there's some jacket support. After the surgery, she is able to move and walk. So those are all things which is not being very few, even in the world, those things have been achieved.
It's a happy thing to have it at our reach, right?
Yes.
So we have now we have a lot of success stories, as you said, and we have a lot of patients, especially in Maldives. We see a lot of patients, mainly because we have had a culture of a bad healthcare system. The result has been that we have a lot of sick people around. Although we are a very healthy nation, but we have the percentage of some diseases are very high. What do you see for the future for these people as an establishment? What are your goals for these people from Maldives?
Yeah, very interesting question. I mean, this is a very interesting thing, but you brought it up to see, so initial stage, as you said, there was a backlog. There was patients, of course, when they're sick, they took a flight, they went, there was not organized properly. Nobody was to monitor and all this.
Yeah.
Now, right now, it is a well monitored, organized way that things are happening. So there is 2 things happening. When our super specialty doctors come here, they screen the patient. All of them are not going to go for surgeries and things like that. At least 80 to 90%, or even I must say 95% of the patients are being guided here itself by the way of medication, by the way of physiotherapy, by many ways. This will be corrected over here through our doctors.
Okay.
So it's not only getting corrected, even also, as the normal say, precaution is better than the cure.
Yeah.
That is also being enlightened by our doctors in a great way. Their lifestyle, their way of the eating habits and things like that are being greatly corrected, and then in very soon you see that nation, they say, you were mentioning that there is a lot of people sick. So this will gradually go down, and I'm sure you will have a
Healthy nation
back in Maldives.
That is the hope. So developing on this, you just mentioned how some patients are taken abroad for surgeries, others are kept here and their medication is completed. Could you explain to the viewers the process of getting consulted by one of your doctors and how the process goes on?
Yeah. There again, as I told you, we are being given, we have registered in all, if you ask in our hospital, we have from A to Z, from liver transplant to neuro to nephro to you name it, any specialty that we have in our hospital.
Okay.
So basically, at least each doctor, each one of them are being registered here, and it is a process of continuous registration. So that we do it through Ministry of Health, and they through Asanda, all that they're very supportive on that. As far as we give the proper documents, and they understand, they screen these doctors caliber, and they feel comfortable, they give the approval. And when they come here, that's as I told you before, they come the regional hospital through Asanda. There is a person who is handling the entire program. So they tell us well ahead, 2 weeks ahead. They will say these are the specialty that we need to, these are the places. So our doctors, we allocate our doctors for that, and we make sure the registration is done, and they come back. Moment they arrive here, there is a person from Asanda's office to take care about the doctor, and then they move them to the related the hospital to consult patients. So by that time, there is a groundwork being done by that particular hospital to area people that there is a particular doctor on this specialty is coming to your hospital here. So please come and see them.
So they already have a short list of people who would be consulting. And then after consulting, how does if a patient has to go for surgery, what is the process that goes on from there?
Okay. So then moment our doctor feel this particular patient is, as I told you, it will be just after entire screening, it will be like 15% of the patient balance. Some needed further test, an MRI or whatever related to that specialty. They need a further test to come into a real evaluation to understand what this ailment is. So they need to take a very good evaluation to be done. So they will see whether that can be done over here with your special infrastructure in Maldives. If not, that patient is asked to come to our center. That is one. So once you go there, they evaluate and they will say yes. If there is a surgery to be done, then at that time they get the approval from Asanda, and then they discuss the amount, package and everything. They do the surgery over there. If otherwise, if they know this has to be only corrected by a surgery, then the local doctor in Maldives has to basically refer, saying that this cannot be done here, then they go over there. So that is the policy of Asanda.
So I understand that you have been working closely with the Maldivian government to develop your services here in the Maldives. How is the response from the government, and what are the future plans for Maldives?
Yes, it is first and foremost I want to say it is well appreciated program right now, and if you ask me how it was and how that they have streamlined the whole thing within this such a short period, it's an amazing task to do it, and I think they have done it, and then there is a lot of chance to improve further. So one of them is earlier people, as I told you, they have an ailment, even say for example, even something, a severe pain in somewhere, they have to take a flight and go either to India or Sri Lanka to show that, and go and meet a consultant. They have to go out of the country with their family members or whoever. So that is completely now taken care over here. Is basically every week 2 to 3 days. And if I say for a month, at least 20 days 20 days from other hospitals also put together, all the hospitals where Asanda is in panel, the super specialty doctors are over here. So somewhere nearby an atoll or Male or Hulmale, wherever, they are there. So the patient, if there is a matter, they can just find out from Asanda, say a specialty like this, whoever available here, they can give the schedule to that patient. Either there is a doctor right now in this location, or this particular doctor is coming on such a date. At least they can prolong for a few days and then show to the doctor who is coming.
How frequent are these visits?
Every month, every hospital get a chance to come. That's how the
But then again, it would be some specialties, right? I mean, all the specialties doctors wouldn't be here, but so for example, a neurosurgeon, how often would a neurosurgeon be involved?
A neurosurgeon, a neurologist, mainly.
Yeah.
A surgeon, very rare he comes, because neurologist will identify whether it is a surgery or not. So we put the neurologist to take care about that matter. And then if you ask me, all the super specialty doctors will get covered within a month. There are some more that rotation will be there, and then there will be a neurosurgeon or neurologist will be here within a month, once or twice.
So every month there will be all the specialties, but
Exactly.
somewhere around involved is.
Because it is not only us. As I told you, there are 9 other hospitals are involved in this program. So even those doctors are coming. So a neurologist comes from our side, and same time from another hospital there will be another doctor also coming. Orthopedic surgeons, and then, as I told you, name it, all the super specialties here.
So about me, what you have? Do you have any plans, future plans with the government for Maldives?
Yes, we are definitely looking at very openly
Bigger options.
big options, and then we have also given. They also have discussed matters with us, like at least to start, they want to take this program to the second level. Now, first level, they have basically covered the entire Maldives, right? So many islands. They have every island. There is a super specialty doctor has gone. That is what I understand. And they are within this year they have covered that total program. Number 2 is that now they want to. That is one of the biggest achievement. I must say it's one of the biggest achievement. That at least the Maldivians, they know that the doctors are coming to their doorstep to see them. So that is one. Number 2 is now they want to go to a level where they want to do small surgeries also over here. So for that we need some. Recently also we were on a tour of evaluating those centers, and then to take up some small type of surgeries. To do that also we need to see that the theater and all these equipments, all that is well set.
Yes.
Then our doctors will do the surgery, and then local doctors will take care from there. Some programs. So we are in a discussion on that. It will also very soon, it will happen to the next stage.
Is there any hope of seeing a global hospitals outlet in Maldives?
Yes, why not? We are looking at, and if there is option, we are happy to be there. We are happy to be there.
So we are coming to an end of the program. Would you like to add some more from your side?
Basically, this we know health is a matter throughout the world, and even a developing country as well as developing countries, and like countries like us, Sri Lanka, Maldives, we have more to go. So definitely this combination is a only solution. I mean, internationally getting connected with local doctors and sharing knowledge, sharing patients, and they very oftenly, if any good programs in India or out of the country, Maldivian doctors are being has attended those this thing, and we make sure that they are invited, and then they share the knowledge that way. So this is the only combination that we can overcome on this. And I want to finally appreciate this Asanda program. And most of the country, even developed countries, I don't think this type of a facility is being given. Sometimes it's unlimited, and we know for a patient, an individual patient, how much at a time they spend, and how much numbers put together, how many numbers that we have on. I can only talk about our center, which we have covered hundreds of patients, and then this program is doing very well. So I only pray to Allah may make this a success thing, and then get that the total benefit let go to the people of Maldives. They deserve it to have these facilities in their own country.
Thank you, Riaz. It was very nice having you on our program, and we look forward to seeing more of your work here in the Maldives, and we wish you all the success in your work that you are doing here and abroad. Thank you.
Thank you very much, and I want to also thank you for your TV. Sangu TV coming and just organized it that you want me to come and say a few words, and then I really appreciate this, because this awareness has to come to the people, right? We have our local representative over here, Rayusha, so most of them they know. So if there is anything they can, it is not necessarily when it comes to question of medical, anything that we could help, we are ready to do that. Even an opinion, a free of opinion. If somebody can just give their reports and say, give me an opinion, we do it free of them. Within 48 hours, that our expertise will see those reports. Is all only thing we have to scan it and send it. It's a technology. Just send it through them. They have a look, and they will give you a comprehensive, a detailed thing to say. This is your problem, this is what we have to do, this will be the cost, how many days it will go, and all that. So finally, I would like to also add one more thing. The moment if we have made it so easy, so much easy with Asanda's staff and our staff put together, moment they are confirmed to go, all what they need is to give us their air ticket. With that, we will program the entire thing from that day. Moment they go and get down at the airport, our service is on from there onwards. There will be somebody to pick them up from the airport. They will take them, and then if it is not a serious ailment, they will not go and admit them in there because of the cost of this thing. But they keep them on an apartment, all that is provided. They don't need to go searching for apartment, stay, food, nothing. All will be arranged, and then we have a very good program for all of them. So it's a matter of just taking a decision and going there, and then all this will happen automatically. Until they will be dropped back at the airport, then it is the global hospital will take care about them. So that is the thing that.
Thank you once again for adding that too. Meduga program hisabu nimmala wakivida round fahakollan oberon program kuriya dieruga program me screen ge tiriyen armen arwada mandiya number tan adi asanda ofihan adi me global hospital ge rajya tiba agent runna contact puravena goitta armen ama meduga program is nimmala ni meduga program kis bedun terina वरम मुहिम मौलूमात के लिबिगन दिया प्रोग्राम का वी का मंग उम्मीद कुरमुं मादमा के प्रोग्राम में सूर्या बेलन तेरना दावतोरम अस्सलाम वालेकुम।